normal sodium level?
135, 145.
Very good. What's your keyword for sodium?
Brain.
Brain. It's all going to be neuro stuff. Yes?
Yes.
All right. So y'all know the job of sodium because you watch the videos. Yes. Okay. What's its job? What's the job of sodium?
Oh, regulate your blood.
Yeah, regulates your blood pressure because what follows salt?
Water.
Water. So it can hold in water. Not gonna. Yeah.
Yes.
Aren't we made up of salt water?
Yes.
Okay. So can maintain blood pressure. It also has nervous system regulation. It helps with the firing off of the action potentials. Yeah.
Yes.
And maintains your blood volume, which is basically the same as blood pressure. Yeah.
Yes.
Okay. Actually, turn your papers over because I need y'all to really critically think on this and not read to me. Okay. So give me some causes of a patient having hyponatremia.
Diarrhea.
Diarrhea, because we've done the GI main in here before, right?
Yes.
Okay. So what's a predominant electrolyte in the gut? Not stomach, gut, sodium. So if you have a lot of diarrhea, you're going to have hyponatremia. Okay. All right. So you understand what I'm saying? If your gut is salty and you're pooping out all your gut, you've lost all your salts. You're going to get hyponatremia. So diarrhea is one of them. Okay. What endocrine condition did we talk about that caused hyponatremia? SIADH. Because what is SIADH? It's an increase of ADH. ADH just holds in water, which would water down our sodium because we're made of salt water. Yeah.
Yes.
Okay. Why would diuretics cause hyponatremia? You're peeing, you're like overriding your kidney's normal systems, right? What 3 electrolytes are your kidney responsible for getting rid of? Sodium, potassium, and chloride. So if you're giving diuretics, it's forcing those out when normally your kidney would be like, should I keep you in? Should I let you go? I don't know. You see what I mean?
Yes.
Okay. Do the easy things first. Okay. Like what would cause your sodium to go really low? Drink a ton of water, right? They actually killed somebody one time doing this. There was a radio show that was doing a game and they brought like 5 volunteers in and you had to drink an entire gallon of water as fast as you could. And the person who could hold their pee the longest won. Now, what do you think happened to that client? Well, that's probably part of it, but also you watered down their sodium. What's your keyword for sodium?
Brain.
Right. So it caused all the cells in their brain to swell. They got cerebral edema and they died. That's called water intoxication. Okay. So if you're going to drink a lot of water, that's fine. You must pee. Yes?
Yes.
Okay. Good to know. All right. Water enemas. Okay. So I'm going to say this and it's going to sound super gross and perverted and I can't help it. Whatever goes in your butt is the same as what goes like in your mouth. It's the same exact tissue. It's the same mucus, same everything. It absorbs the same way. So whatever you put in your butt is going to absorb systemically the same way that something you put in your mouth would. Okay. Okay. So let me give you an example. There was like a couple summers ago, this is super gross and I know that, and I'm never putting this on the internet because of that. Where these teenage girls were taking tampons and soaking them in vodka and then going and like putting them up in their vaginal area or in their bottoms because it absorbs the exact same way because it's made out of the same as mucous membranes, right? So it will systemically absorb. So if you give a tap water enema, which is very common, right? Where they just put a bunch of water up your bum, right? Your body is going to absorb all that water, right? So that's basically another water intoxication. Do you understand what I mean?
Yes.
Okay. Which is why usually they'll give like a saline enema, which is probably a little bit better than just tap water enema, which sounds super gross anyway. You know how gross our tap water is? Hi, that's a parasite waiting to happen, but okay. Anyhow, all right. So signs and symptoms of hyponatremia.
Neuro changes.
All right. So all your neuro words, if you see a neuro word, you're going to pick it on an exam. Okay. Like headache, confusion, fatigue, seizures, coma, lethargy. Those are all like neuro things. Yeah. Weakness, ataxia, because your brain's all, what's ataxia? Drunk walk. Yeah. Because your brain's like, I don't know. Okay. Nausea, vomiting. Oh my God. Okay. Nausea, vomiting, anorexia. Why would you have that? Because you have nausea and vomiting. Nausea, vomiting, and anorexia. Anorexia just means I don't feel like eating. It's not a disease, right?
But don't they throw up a lot? So like they're throwing up all of their fluid?
Like water. They're trying to kind of like get rid of that extra water, right? And then if you're like very waterlogged, you're not going to feel like eating, right? Okay. All right. How would I treat low sodium? Give them sodium. Y'all, these are very easy if you just like, okay. So if it's a very mild, what type of fluid would I give that patient? If it's a mild hyponatremia. Yeah, so we could give normal saline, right? If it is severe, if it's like in the 120s, then what kind of fluid would I give?
5%.
A hypertonic solution, which is 3% normal saline. You have to be very careful when you mess with salt, okay? Because it pulls fluid so beautifully. What happens if I give hypertonic saline very quickly? It's going to shrink all your brain cells and cause cerebral edema, and the patient could die. So anytime I'm changing sodium levels, I have to do it very slowly. So you're never going to give a bolus of a hypertonic solution that is salt. Oh, do you understand what I'm saying?
Yeah.
Now D50 will slam if they're in hypoglycemia, right? But as far as salt, you better quit it. You understand?
Yes.
Okay. All right. So let's talk about causes of hypernatremia. What would cause you to have high salt? Get very simple.
Yeah.
You ate a lot of salt. That's simple. Yes. Okay, go on. DI was so diabetes insipidus because you're peeing out straight water, which leaves you salty. Yes.
Yes.
Go on.
Watery diarrhea.
Oh yeah, watery diarrhea can do that. Have you ever had diarrhea where it's like you're just peeing out your butt? Okay. Well, because it's like I have. So I should have said your name. Anyhow, no, everybody has, you know. But if you're peeing, no, not peeing, if you're pooping out just water, that leaves you very salty. Yes.
Yes.
Okay.
So with throwing up being on our nose, is that just for
No,
hypo?
it's
Okay.
that's for more for hypo.
Okay.
And it's really more for potassium, but you will see vomiting listed in hyponatremia too. You would have to have severe vomiting
Okay.
to have hyponatremia. All right. What about if we said a water enema caused hyponatremia, then a saline enema would cause, oh, hello. So just think, what do you put in your mouth? What do you put in your butt? Those are very easy causes of either of these. Yes.
Yes.
Okay. All right. What endocrine diseases caused hypernatremia? Okay, DI. What else? It is Cushing's. It is Cushing's because Cushing's is an excess of aldosterone. What's aldosterone's job? Holding salt and water. Yes.
Yes.
Okay. And if they don't diagnose them with straight up Cushing's, there is something called hyperaldosteronism, which is basically the same thing as Cushing's, just the aldosterone part, right? All right. So signs and symptoms of high sodium.
Headache.
They're the same, right? So headache, confusion, seizures. Yeah. But you have to think about what happens when you eat a ton of salt. Like let's say you go to a party or whatever, right? You eat like pretzels and pizza and like you wake up the next morning. Yeah, your fingers are kind of like puffy. You do feel dry. You're real thirsty. Your skin's kind of flushed. Yeah. So you add those with hypernatremia. Okay. All right. How do I fix hypernatremia? Huh? No salt. So I'm going to restrict their salts and give them water. So I'm going to tell them if they're like awake and alert, drink some water. Yeah. And if they're not awake and alert, then I would give them what type of solution? A hypotonic solution. Yeah.
Yep.
That's it. That's all of sodium. Boom. Oh, see, it's easier than you think when you understand it. All right, let's go to potassium. What's a normal potassium level? 3.5 to 5. What's potassium's keyword?
Heart.
Heart. Okay. Because there's an action potential